The medical condition known as hemorrhoids or piles involves swollen veins in the lower part of the anus and rectum. These swollen vessels can become irritated when their walls stretch. Hemorrhoids are often caused by factors such as older age, pregnancy, and constipation. Though hemorrhoids can be painful at times, they tend to improve without treatment. Lifestyle changes such as increasing fiber intake and exercise can help alleviate symptoms and reduce the risk of future hemorrhoids. We are excited that Dr. Clifford Masese from Valley Hospital in Nakuru County is joining us for this episode of Health Check with me, Roxana Gishia. Today, we explore the symptoms, causes, and treatment options for hemorrhoids, how to prevent hemorrhoids, and when to seek help. Karibu sana daktari.
Thank you.
How are you doing? How is your day today?
My day is good.
Uh-huh.
Yes.
So, you're welcome to join us today. Thank you so much for coming. And today we'll be talking about hemorrhoids. I feel like hemorrhoids is something that we need to talk about because it's something that most people assume. Most people, I don't think even they have heard about it. So when is the first time you heard the word hemorrhoids?
The word hemorrhoids, I knew it when I joined medical school. Mm-hmm. That's when I came to know the hemorrhoids.
So if you were not a doctor, you could not know what hemorrhoid was.
Exactly.
That is so sad. So I'm sure most of the people who are listening to us as well have never heard of the term hemorrhoids. So what is hemorrhoids?
So probably I'll start with explaining that hemorrhoids happen or occur around the anal canal. So in the anal canal, there are blood vessels which are supplied by with the blood. Mm-hmm. They are spongy, which makes them assist us during bowel movement. Okay. So it doesn't make the process painful. Okay. But now when you have hemorrhoids, these blood vessels become swollen, inflamed, and now they can cause symptoms or can't cause any symptoms. Okay. Can be asymptomatic.
Okay. So yes. You said some causes the symptoms and some does not.
Yes.
So if for the ones that does not cause the symptoms, how do you know they are hemorrhoids?
So there's a classification of hemorrhoids. Okay. We have the internal hemorrhoids and external hemorrhoids. So internal hemorrhoids occur in the anal canal. Above, there's a line, we call it dentate line. Okay. So they occur above. So you may not see them or feel them. But the external hemorrhoids, which occur below the dentate line, sometimes they grow and you can feel them even by touch. So there's that feeling that there's something bugging somebody. So that's how you can know that there's something down there. Okay. That's now when maybe you can come to the hospital to inquire what could be that.
Okay. Yes. So between the external hemorrhoids and the internal hemorrhoids, which one are more dangerous than the other one?
Probably I can say the internal hemorrhoids.
Okay. Why?
Because they may be there and you don't know that they are there. At least the external ones, which you feel that there's something, you will seek medical attention. Okay. Yes. Yeah.
So, okay, let me get this clear. Does the external hemorrhoids hang outside the anus or how do they occur?
It's a growth. So sometimes you can feel it, like there's something. It's a growth. You can feel it.
When you're pooping or when are you feeling this?
Of course, probably, you see when now they cause symptoms, there could be pain, there could be itchiness, there could be bleeding. Okay. So you see, you'll once you have those symptoms, you'll want to seek medical attention. Okay.
Yes. Are the itchiness, bleeding, and pain, are they the only signs and symptoms of hemorrhoids?
Mostly they're the ones.
Okay.
Yes.
Okay. And so at what point should one see the doctor? Like, because I understand sometimes you just feel like scratching, but sometimes you feel like it's normal, or maybe I didn't take a shower well in the morning. So when is the appropriate time to go and seek medical attention?
So once they start being symptomatic, of course you'll some patients come with very severe pains. Some even fear to go to the washrooms because of the pain.
Okay.
Some bleed a lot. They can even have anemia, that's low blood level.
Okay.
And actually it's good to come to hospital so that we differentiate. Is it really a hemorrhoid? Is it something else? Could be anal fissures, could be polyps, could be just a skin tag, or could be even a serious condition like cancer. So it's always good to come to hospital so that we look at it, we investigate, and then we come up there with the right diagnosis and treatment.
So what's the difference between hemorrhoids and anal fissures?
As I've said, a hemorrhoid is the swollen, inflamed blood vessels. Anal fissure, I can say it's a tear around the anal canal. So a tear can also present like hemorrhoids. You'll feel pain. There could be bleeding also. And also that itchiness could be there. Yes.
So how do you differentiate? Because I can see the symptoms are almost the same. So is it that the hemorrhoids one does not have the tear? Because I'm assuming when you're experiencing constipation, and now of course you have to force the poop out, and when you're forcing it out, and maybe you have external hemorrhoids, I'm assuming, again you'll clarify that for us, that it might cause some tear.
True.
So when it causes tear, does that is that considered as anal fissures, or is it still a hemorrhoids?
So once you come to hospital, of course we listen to your symptoms. We always do an examination. So I can just have a bare examination, just checking. That can tell me a lot, because anal fissures, I can really see this is an anal fissure. And then we can go on and do other imaging. So we have imaging like anoscopy. We do have a colonoscopy and sigmoidoscopy. So at Valley Hospital we have a colonoscopy and we can do anoscopy. So at least we can come up with a correct diagnosis.
So let's just talk about the checking. So I'm a patient. I've experienced the painful while going to the loo. I'm feeling like I feel like I'm itching or something. I'm feeling pain. I can see blood. Now I've come to the hospital. I've found you. And I'm telling you, doc, by the way, I'm suspecting I have hemorrhoids. So you go ahead and check me. What is that check? We want to know, what is that checking? Like, what does that checking look like?
So we have, of course, the examination. I look. Once I look, I can tell.
By look, you mean drop your pants, let me check?
Yes. I have to examine. Yes. So, of course, I have to explain to the patient that this is what I'm going to do. And if it's a lady, sometimes we have somebody being with us. So, if the patient feels like she's uncomfortable, we give her time. But I'll have to explain the importance of examination. And then sometimes we do what we call a DRE. That's a digital rectal examination. So if you feel that they are internal hemorrhoids, you have to go in with your finger, feel whatever could be there, and then you have to record I have to record my findings. So this is what I saw. Probably there's a bleeding in my finger. What did I feel inside there? Is it a growth which is mobile or hard? So I'll have to have my recordings. And then now I might recommend now higher imaging, probably colonoscopy, because now it depends on what I feel I'm managing.
Okay, so let's talk about the causes. What are the causes of hemorrhoids?
So I won't say there's a real etiology, the cause, but we have the risk factors. So some of the risk factors are constipation. So probably we have people who don't take a good, like, poor diet. Low fiber diet. So that's one cause. Low fiber diet, constipation will occur. Pregnancy is another risk factor. obesity. So people who are obese, they are at high risk of having that hemorrhoids. Aging. So old people also are at a higher risk of having hemorrhoids, and people who go to the gym. One more, people who have prolonged sitting, like people work in office. They are also at a higher risk. Yes.
Let's talk about the people who are employed in offices and everything, because sometimes you get you're employed to do an 8 to 5, and of course you just your work is just sitting on a computer all day, all long. So what can you advise that person who their work is to sit on a computer, write the reports, write the articles, write everything, but they don't really have a chance? The only moment they stand is when they're going to the loo. What can we do for them? Because at times you have to do it, because again you have to pay your bills, but again you also have to consider your health, because once you have hemorrhoids, it's another case.
So one thing I'll advise them is that they live a healthy life. So by healthy life is the good diet. That's a high fiber diet. Taking plenty of water, and minimize that prolonged sitting. They can also have probably talk to their bosses so that they have the proper seat, which is comfortable and with the proper ergonomics. So I think those things can reduce the chances of having hemorrhoids.
You've talked about low fiber diets. Let's just give us examples of high fiber diets, so that when we are cooking again or choosing what to eat during lunchtime, supper or something, then we can consider those diets.
So high fiber diet is fruits, all kinds of fruits. Taking vegetables, and if our nutritionists, the way our nutritionists advise us is taking plenty of vegetables, probably a small amount of carbohydrate and a small amount of protein. So in that, at least the process of metabolism and bowel evacuation will be easier. Yes, so we'll minimize the chances of constipation.
Yes. So we've also talked about obesity. So how can I know I'm obese?
So obesity, we calculate. There's a way we calculate by your height and weight. Yes. So there's a formula.
So it's I know it's I don't know if it's weight over weight or weight over height. Height over weight.
It's weight over height squared.
Yes. Let's calculate mine.
But nowadays we have phones where you can just enter your weight and height and just gives you the BMI. Yes.
Let's calculate mine for a minute.
Yes.
So the last time I weighed myself, I was 73 kgs. Yeah. I am 5'4". 5'4" foot ni how many centimeters? 160 something, or
let's say 160.
Let's say 160. Yes. So it's 160 over 73,
so it is 1.6.
1.6
squared.
1.6 squared.
Yes.
That is like 3.2. 1.6 squared is 32. Yeah, 32. 3.2, that is.
So we have the ranges, the normal ranges between 19.5 to 24.5. That's the normal BMI. So above 25 to let's say 29, that's overweight. Yeah. And then we have grade 1 obesity. That's 31 to around 34, and then grade 2 obesity. Yes.
So the people who are away from that, I hope you guys are actually calculating your weight so that we can see if you are at a risk of getting hemorrhoids. But away from that, the people who are given medicine over the counter. So you go to a chemist, maybe because I don't have money to go to a proper hospital, then I just go to a chemist and tell them this is how I'm feeling. Sometimes they're given medicine like what's the name of this one? There is an
ointment.
An ointment.
Anosol.
Yes,
it could be anosol or a suppositories. Yes.
Yeah. So how effective is that? Number one. Number two, how do I know what works for me?
So either the ointment or the suppository, they are recommended.
Yeah.
The reason being they have analgesic and an anti-inflammatory effect.
Okay.
So they'll minimize pain, and at the same time, they're like a treatment to the hemorrhoids.
Okay.
So I'll still recommend, but the best is to come to hospital so that, as I've said, it could be something else.
Okay.
Yeah.
Okay.
Could be something else, not really hemorrhoids.
Hemorrhoids.
Yes.
Okay. Again, I've heard about people saying that hemorrhoids. Okay, that one has disappeared. Let me just confirm. Yes. What are some of the I've heard people say that you can cure hemorrhoids by some natural remedies. How true is that statement?
Of course, we do have many people who claim to treat several types of conditions.
Yeah.
But for me, having acquired medical information, and I believe in standards, I will not really go into talking about those, because I believe in science.
Okay.
Yes.
Okay. So what are other myths that you've heard about hemorrhoids?
About hemorrhoids, I've not had any myths. It's not a complex issue, and it's not something which people talk really about.
Yeah.
You see, there are those conditions which people can openly talk about.
Yeah.
So even in the office, probably you have people with hemorrhoids or anal fissures, but they won't tell you that, my friend, do you not have this thing disturbing me here?
Yeah.
So that's his or her secret.
Okay.
And he'll only come to hospital and be confidential to the doctor. So it's something which is rarely talked about.
Okay.
Yes.
And does it affect both genders or?
Yes, it affects both genders. Actually, the only population which is less affected is hemorrhoids are uncommon to children. But adults and older people, they both equally suffer the same condition.
Okay.
Yes.
So how can we treat hemorrhoids?
So hemorrhoids, one, we've said prevention is better than cure, of course. So that healthy living, a balance of life, a balance of everything. So we've talked about a healthy diet, high fiber diet, fruits and vegetables in plenty, taking enough amount of water, doing exercise, keeping fit, because now, like, people who are obese, we are also trying to reduce that. And then now, if you have the hemorrhoids, treatment, we have laxatives, something which you can take to reduce constipation, make bowel movement easier, because again, we don't want you to go to the washrooms and sit there for long. That's another cause of that. And then we encourage sitz baths. So this is sitting in water, warm water. You add salt in it and sit for some time, maybe 30 minutes, even twice a day. So it assists in trying to shrink those hemorrhoids. And then we have drugs which you can prescribe. We have oral drugs, and then we have those ointment and suppositories. Now, if the hemorrhoids become symptomatic, pain, that's now when we can seek the services of a surgeon. So the surgeon now can recommend the different types of treatments, like going to surgery, or there are different types of management, surgical management they can advise. Yes.
About the surgery part, does it mean that when I go for surgery, the whole hemorrhoids is done with? Because I understand there are some cases where they reoccur. So does me going to surgery makes me, is it a guarantee when I go to surgery that they are not going to occur again?
Okay. About surgery, let me explain with my diagram here. So this is another classification of hemorrhoids. So we have grade 1, grade 2, grade 3, and grade 4. So grade 1 is where they don't prolapse outside. They are just inwards. Here, they may disappear spontaneously. Grade 2 is when during bowel movement they come out, they move out, but they can go in after you are done with your business. And then grade 3 is whereby it prolapses outside, and you maybe manually have to try to fix it back. And then grade 4 is when now you even if you try to put it back manually, it still permanently stays out. And in my experience, I've met like very big hemorrhoids, very visible big ones, and they are very painful. So in mostly surgery, we do for grade 3 and grade 4. Actually, mostly it's grade 4, but in some cases, grade 3 can also, patients with grade 3 can also go for surgery. Yes, so hemorrhoids can recur. Yes, after surgery.
After surgery?
Yes, they can
So
recur.
it's not a guarantee?
Because there are many blood vessels around that area. And we've seen the causes. So if you still don't lead a healthy life, they can recur. Yes. I saw a journalist who went for surgery, and when they came back, it was so severe because they couldn't take themselves to the washrooms. They couldn't do anything for them. How severe is the surgery? Okay, I'm assuming I've gone to the surgery room. Kwanza, do they inject me those sleeping pills so that I cannot feel pain during the surgery? And then now, after the surgery, it's impossible to sit down because maybe it has not healed yet. Again, I still have to go to the loo after everything, What can I do during that situation? So after surgery, of course, you ask about, let me call it numbing. So they numb that area. So you won't feel pain during the surgery. But after the surgery, you can have now pain coming in. Mostly we recommend probably a liquid diet so that we minimize that straining again. So a liquid diet, and we can put you in very strong painkillers so that you don't have that fear. And then also we recommend sitz baths. Now, of course, there's a wound there, so there'll be pain. But we try to minimize that pain. We make you as comfortable as possible.
Yes. So how long is the recovery period after surgery?
Recovery depends
with an individual.
with an individual, but the patients I've seen maybe 3 days, 4 days. Again, it depends on how big the hemorrhoids are. Yes.
Okay. Let's go back to pregnancy and hemorrhoids. Why are pregnant women getting hemorrhoids? Number one. Number two, we've said there are those things like anosol that you can take during that period. Do they affect the kid that you're carrying?
Now, the hemorrhoids occur when there's intra-abdominal pressure. Remember, this pregnant lady is carrying a heavy load, so there's some pressure. And again, during that time or period, there's a lot of hormonal changes which occur, which can make either the connective tissue around the anal area become a bit weak. So those two things can cause that hemorrhoids to occur. These suppositories or ointments, they don't have any effect to the baby. So the pregnant women can.
Oh, so they are safe.
They are safe. Yeah.
Okay. So you said they are the oral pills. Okay, not pills, medication that people can take. They are also safe.
They are safe.
Okay. Okay. You talked about the hemorrhoids. Some of them are so large. Can they block the anus?
I cannot really say they can block, but they can cause a lot of pain. And this pain can make the patient fear going to the washrooms. Yes.
So what would you advise someone who is currently have the hemorrhoids, either internal or external?
First of all, I do encourage them to take a lot of water, have a high fiber diet, but come to hospital.
Okay.
As I've said, we have the imaging at Valley Hospital, for example. We can do, we have to rule out. Actually, we even take a sample, a bit of sample, we take it for histology, because I've said we have to rule out any other thing, any other serious condition which the patient can suffer from.
Okay.
Yes.
And what advice again can you give to someone, to family, friends who know someone who is experiencing hemorrhoids? Because I understand when, for example, it's stage 4 and I have to go for surgery, and now I'm back and I cannot do some things for myself. Again, I need support from the family, and most of them don't really understand what hemorrhoids are. So what can you advise the friends and family for a patient who has hemorrhoids, especially stage 4 hemorrhoids?
I can only encourage them to seek medical advice, attention. They should not fear, because like I've said, the surgeries I've seen, the patient's recovery time was short. Yes. And we give proper medications. We alleviate the pain. So there is nothing they have to fear.
Okay.
Yes.
And how can the family support them during this process?
Mostly family support is making sure they have the proper diet. Like I've said, they need sitz baths, so they need that water, which is they like prepared to the right temperatures. Mostly doesn't need a lot of care. Yes, the person can really support himself.
Okay.
Yes.
Okay. So let's go to something that I forgot, and I think it's very important. Is hemorrhoids genetic?
No.
Okay.
It can't be genetic.
It can't be. It can't. Why are you saying it can't be genetic?
It is not genetic.
So if your mother or your father had hemorrhoids, you're safe. If you take care of yourself.
Yes, it's not genetic.
Okay. So where can people get you, doctor?
So I am at Valley Hospital.
Okay.
Valley Hospital, we are located at West Road, just next to Waterback Hotel.
Okay.
Or easier, Westside Mall, 100 meters on the Westside Road.
Okay.
Yes.
Okay. One more thing before we leave. Do you think the government is doing enough to support hospitals, especially in providing equipments for surgical, for actually equipments for the surgical part where hemorrhoids are involved? Because I'm sure most people need attention, especially when they are at stage 4.
I think there's proper support from the government, because the doctors are there.
Okay.
The theater is well equipped, so I think there's enough support.
Okay, last one. Where do you want people to be 5 years from now when hemorrhoids, when hemorrhoids is mentioned? Like, when you talk about hemorrhoids, where do you want us to be 5 years from now?
Of course, we hope for the best. We hope that Kenya will advance in terms of healthcare. The problem with our society now is we are not taking our traditional healthy foods.
Yeah.
Nowadays, fast foods are springing up from every corner of the town.
Yeah.
So that's the problem. But with proper education, information being provided to the population, I think we are going to be in a better position.
Okay.
Yes.
Yeah.
Yes.
Thank you so much for coming. It was an honor having these discussions with you. And for you guys listening to me, thank you so much for always watching us. If you've not watched our previous episode, we were talking about endometriosis, and even the other episode which we were talking about sickle cell disease, please go watch on Koilib TV on YouTube. And again, you can always check us out on all our social media handles, that is at Koilib TV. This has been Health Check with me, Roxana Gishia, and Dr. Masese. Thank you so much. See you next week.